Welcome, everyone. While we give folks a few minutes to join, please go ahead and indicate in the chat where you're from or which organization or country you're joining us from, so we have a sense of who you are. And thanks for joining us today. Hi, Cosette, thanks for joining us. Anyone else wants to let us know where they're joining us from? And you can send your chat to everyone so that everyone can see your responses. Hi, Herbert. Thanks for joining us. I'm wondering if anyone is really close to the beach. And when last you've been to the beach?
Right now?
Wherever you're joining us from. Are you close to the beach? Can you see the sea or the ocean, depending on where you are?
I have a good waterfront. I can see Lake Ontario. So
you're seeing Lake Ontario. And I imagine that's cold, not warm.
It's warm now, actually.
But I imagine the lake is always cold. I find Lake Ontario always cold.
I've not taken the effort to swim, not yet.
Maybe it's because I'm from the tropics, but I find lake water punishing. We have more people joining us. Hi, Farida from Namibia. The Skeleton Coast is beautiful in Namibia. All right. So we'll get started as people join. Welcome, everyone. Thanks for joining us. I'm Tamara Hafner, Principal Technical Advisor on the USAID MTaPS program and the moderator for today's session. Just a few quick tips before we start. You'll see that we have so the audience is muted, and so we ask that you submit your questions and comments as we go along through the chat box. Please disregard the Q&A function and just use the chat box to make it easier for everyone. We're aiming for a very dynamic conversation today, so please feel free to submit your questions and comments, and if you have any reflections on experiences in your own context as we discuss the topic today, please go ahead and use the chat box liberally to share your thoughts. So a bit of background, again, as I mentioned, I'm Tamara, a Principal Technical Advisor on the USAID MTaPS program. USAID MTaPS goal is to enable low and middle income countries to strengthen their pharmaceutical system to ensure sustainable access to and appropriate use of essential medicines and related services. MTaPS is implemented by a consortium of partners led by Management Sciences for Health. Any attempt to sustainably improve equitable access to quality pharmacy services must include strategic considerations of how to effectively leverage retail drug outlets, specifically pharmacies and drug shops. These outlets are often the first or only point of contact for health services, particularly in rural areas in some low and middle income countries. With that in mind, MTaPS is hosting this 5-part webinar series to explore the theme of advancing equitable access to quality pharmacy services through retail drug outlets. The ultimate aim of the series is to help highlight existing policies and strategies that can be used as elements in defining a pathway towards more equitable access to quality services through the private sector. Today's webinar is the third in the series, and we'll be focusing specifically on opportunities provided by e-pharmacy and other market-disruptive innovations in patient-centered care, recognizing the critical need to regulate and monitor these pharmacies to help ensure patient safety, and also considering specifically what the equity impacts are for the more vulnerable groups of the population. And with me, I have a very esteemed and dynamic panel. We have Remy Andushan, Director at Salient Advisory, Francis Wafula, Professor at Strathmore University in Kenya, Justin Newcomb, Senior Vice President, Public Health, Swipe RX. We have Fanny Hendricks, Pharmacy, and we have Wilfred, who is from the Pharmacy Employees Board. So thanks everyone, and you will see that we'll be posting a brief bio of each of the panelists in the chat, just to so you can read a little bit more about their background as you see fit. So what to expect over the next 85 minutes, or now 80 minutes. We will start with a couple of questions to get us all on the same page, hear a little bit about the different organizations presented on the panel today, and then we'll expand our discussion to talk a little bit in more detail about the innovations and the implications, both in terms of regulation and also in terms of equity impacts. So in all, we have about 45 minutes of a panel discussion, 20 minutes of dedicated Q&A, and then about 15 to 20 minutes of summation and closeout. And again, please treat this as a conversation. So submit your questions as we go along, and where possible and where relevant, I will weave in your questions for the panel as we proceed. So with that, let's dive right into it. And we will start by a couple of questions for Remy, and yes, Remy will kick us off. So could you provide a brief overview of emerging trends in pharmacy services innovation across low and middle income countries for us, Remy? Over to you.
Thank you very much, Tamara, and a very good morning to you. Good afternoon, wherever you may be. Happy to be here with the rest of this esteemed panel. And my feedback is coming especially on the backdrop of a report that my organization, Salient Advisory, is launching today. So this is such a very lovely coincidence that the 2022 report on innovations in digitizing distribution of medicines in 4 African countries is being launched as we speak. And that tracks essentially the innovations that Tamara is asking about. And given the diversity of this panel, I will to a large extent confine many of my responses to the African continent, since we have some complementarity with Jocelyn coming from Asia and Fanny from South Africa. So the trends are very exciting. The last year has been a very dynamic one. If we look to the overall investment in the tech that is driving change in pharmaceutical services across Africa, there's been an upsurge. Relative to the rest of the tech space, it's still a bit low, less than 10% of total investment in tech in Africa is coming to health. But the part that is coming is actually driving change in pharmaceutical services. And just for context, when we look at the retail drug outlet, you might wonder why that's a little bit vague description, retail drug outlets in low and middle income countries. I guess for those who are joining from outside of LMICs, you have just the pharmacy. But in Africa and many other parts of the LMICs, you have the pharmacies and what we call the drug shops, which are the lower cadre outlets where you can get medicines. And all of them are still benefiting from this change that is happening. The main trends we see is that innovators are helping now to solve access problems. If we look to see the distribution of pharmacies, which are usually more urban in their location, you have innovators now that are through solutions for inventory management software, and for consumer-facing product location and other such, e-pharmacy approaches, they're helping to bridge the gap between the distance of where people live and where the nearest retail drug outlet is available. So that is spurring a lot of improvements in access. And with technology, one of the things you also find is that as it helps to reduce the layers in the supply chain, there's also the benefit that comes with that of reduced price to the patient. So affordability is getting better. And this is all triggering even more investment, a trend that we see to be very helpful. Regulation usually lags behind innovation. And so last year, we had identified that regulation was lacking. There wasn't a single country in where we were tracking that had regulations covering online pharmacy, which are driving change. But as that now, we have at least 2 of the countries, Nigeria and Ghana, that have actually published regulations for online pharmacy, and many others like Kenya and Uganda are close by. I think South Africa and Rwanda had always had, but amongst the country, we focus on those 4, Uganda, Kenya, Nigeria, and Ghana. There's been that progress. And the International Pharmaceutical Federation also tracks this. Just about 8% of African countries, as of November 2021, had guidelines, covering the regulation of online pharmacy. So that's the last most important trend we see is the responsiveness of the investing community. Now, one of the recommendations we had last year was that they need to invest in African founders, especially women founders and those from disadvantaged areas. And this is receiving very good response. There's been marked commercial investment. And today also the Gates Foundation is launching a $7 million Pan-African initiative called the Investing in Innovation Fund that will help innovators, about 60 of them over a 2-year period, to improve their access to markets and also commercialize their products. So all of these are giving real fillip to improvement in pharmacy drug services across the continent in Africa.
It's great, and it seems like a really exciting time in terms of the changes that are coming, and we're hoping that will trickle down to all segments of the market for pharmacy services. Frank, I'm wondering if you have anything to add to what the overview that Remy shared with us.
Hardly. That was extremely comprehensive. Maybe just to highlight that the excessive fragmentation in the retail pharma sector, and that covers all levels of pharmacies and drug shops, has been a major problem. And so, some of these disruptors are actually moving, they're going beyond the individual technology or the individual value proposition. So, we are now seeing, for example, talks about more consolidation within the industry, which of course brings additional benefits in terms of volumes and pool procurement or purchasing and then pricing eventually. So that's a really important innovation as well. And of course, you're also seeing quite a bit of vertical integration. And I think Remy touched on that a little bit. So we are seeing the middleman being cut out more, and technology is driving a lot of that. And of course, we're going to talk about this downstream, but that of course has policy and regulatory implications. How then does policy respond to all these changes that are coming from different directions? Thank you.
Exactly. Thank you. We're going to get to the bit about the policy and the regulatory response, and before we do that, I think it'd be good to just kind of quickly highlight and hear from some of these innovators. So Jocelyn, over to you. I'm wondering if you can tell us a little bit about Swiper, describing the platform and its effect or impact on pharmacy practice in the Southeast Asia area where you work, and how it's being leveraged to improve the quality of services in the region. Over to you.
Thank you, Tamara. It's a pleasure to be with all of you today. And on behalf of SwiperX, really privileged to share our experience in Southeast Asia. SwiperX is the largest digital network of pharmacy professionals in the Southeast Asia region. And since launching in 2017, so less than 5 years ago, the app has grown to connect more than 240,000 users from over 45,000 pharmacies across the region. Majority of our users are pharmacists, and more than 2/3 of our users are women. But our app is also used by pharmacy owners, managers, technicians, and pharmacy students. And our partners, including global health partners, leverage SwipeRx to communicate with thousands of pharmacy professionals quickly, cost efficiently, and pandemic safely on a single platform. We work with global health partners to conduct highly segmented research, so we're able to target by user demographic and geographic location in the markets where we work. We are able to deliver targeted news and disease-specific digital behavior change campaigns to pharmacy professionals. We can customize features for pharmacists. For example, we have an integrated e-referral tool, which makes it easier for pharmacy professionals to screen and refer clients who need care at a health facility, whether that's contraceptive choice, whether that's care for an STI symptom or TB symptoms, etc. And we are the largest provider of accredited digital continuing professional education for pharmacists and pharmacy assistants or technicians in the region. We deliver digital education modules and webinars through our platform, which enable pharmacy professionals to stay current with their technical and professional information, but also allow them to earn the CBD units that they need to renew their licenses. In Indonesia, we're strengthening the pharmacy supply chain and helping to introduce new drugs and rapid diagnostics using our B2B e-commerce procurement platform. We are known as a company as SwipeRx. We formerly were known as mClinica. We're a tech startup, and we believe in the power of technology to help pharmacies operate more efficiently and more effectively. Thank you.
Thank you, Jocelyn. And so for those of you who've been following the webinar series, you know, we started out talking about good pharmacy practice. And here we see an example of technology that really helps to help pharmacists keep up with their training and improve their practice. And so here's another example of technology being leveraged in that regard as well. Over to you, Fani. Can you tell us a little bit about Right to E-Pharmacy? What are some of the critical pain points being addressed with respect to pharmacy service quality and access? And what are some of the specific equity outcomes or impacts you can point to?
Thanks, Tamara. Yeah, I think, just a bit about Right E-Pharmacy to start with. Innovation startup started in 2016. And basically aimed at, looking at alternative ways or differentiated models of care to improve patients' lives, firstly in South Africa. I think our scope of work is actually the dispensing, distribution, and collection of medicine. And we apply tech to monitor and innovations to monitor those processes. Some of our work is well known, and we've been obviously had a few rewards. But I think our first project that maybe just to highlight 2 or 3 of them, the first one was we were the innovators of the ATM pharmacy. And actually, as we speak, in 2019, the pilots in the US only started. We started in 2016 already. We were also the first company to automate 3 public health facilities in South Africa with European robotics, which we customized to be suitable for the public health sector. After that, we started with digitizing prescriptions and decanting patients from overburdened facilities, together with AWS or Amazon Web Services. And that actually brought us to another product, which we called Collect and Go Smart Lockers, all well known overseas for e-commerce pickups. And what we've done is we actually then built a lot of suites of products around that. So we originally started as the ATM pharmacy, but now got about 10 products out in the market. And we've, in the last 2.5 years, ventured into Eswatini, Lesotho, Botswana, and then also Zambia, and currently in talks with the DRC, Kenya, and a few other places. So yeah, I think the whole thing about the last mile in our definition, I think, being a pharmacist myself, I think is really to say we start where the patient picks up medicine. So that is where we would like to see ourselves as a differentiator. We know there's a lot of people that's working on bulk systems, control towers and all of that. We think our part of the part of our contribution would be that really to start at the patient and work it upstream. So literally, if you can't manage the commodity and you can't manage the patient, and if you can't manage the pickup, you really can't manage the outcome. So, and that's where we focus. So I think in South Africa, the challenges are different than Lesotho, and the same with Zambia and the same with Botswana. So I think the interesting thing about our journey is you just think everything, and then you just think as you enter a country, you start from scratch again. So it's been an interesting journey, and I think the reality is the patient's got so many challenges to face, and when you start looking at firstly at the patient, you firstly realize that obviously I think the supply or the healthcare system in most of these countries are overburdened. Obviously in South Africa, we've got a huge shortage of pharmacists, and then obviously just limited of infrastructure. And I think that's from the outside side. Now just imagine being a patient, we all know about the horrible waiting times, and just to find out the medicine is not available. We all know about the patient experience, the negative impact on the economy, on the patient and the economy. And then you can just imagine, the poor healthcare outcomes. I think what we've seen is if you start monitoring the collection of patients and work it upstream, digitizing the script, understanding the patient's repeats and having contact with them, I think you can start seeing, as soon as you can start doing that, then suddenly all the big terms like universal health coverage and all of that makes sense. If you can't do that, unfortunately, I think we still got a long way to go. So I think our part in the pharmacy side would be to say, we differentiate ourselves by being really last mile patient-centric solution providers.
Thank you, Fani. I was wondering, when we talk about these patients, can you just, in a minute or two, just give us a quick overview of what segments of the population are currently using your services? And I know you operate in several different countries, so it might differ, but what percentage of your patients represent, that lower income or vulnerable group? Over.
So currently, about 95% of all our patients are public health patients. So we've not really actively ventured into the private sector yet, because it's only in South Africa where we've got in Sub-Sahara where we've got a very strong insured market. So only 8 million insured patients, but 50 million uninsured. So and obviously outside of South Africa the number is much different. So 90% of our patients are 90, I would say 99% is actually public health patients. So that gives you an idea where we're operating. So totally from urban to peri-urban, etc.
And I imagine that also, besides partnership with governments in the countries that you work, are there any other major partners that are involved in the initiatives you're working in?
Yeah, lots of partners. I think the one thing that you figure out as you go along in the innovation journey is if you're going on your own, you're not going to go far. So what we've done is we've collaborated with various partners. I think notably, obviously, USAID has been critical in supporting our solutions. We've got multiple, I would say, NGOs and stakeholders involved. From Right to Care, which is actually holding the shares in our business. We're doing a project for FHI. We've got Japago now building on that project. We work obviously with all the ministries. But of CDC, and we've got various other partners on the ground that's got a different role in the supply chain, that actually has understood over the last couple of years that we're not taking over the supply chain. We just want to look at the patient-centric problem and tap into the supply chain systems already in place. But we've got multiple partners that we're collaborating in South Africa as well. So yeah, it's but I think notably would be USAID and in a lesser demand probably the Global Fund.
Okay,
great. Thank you, Jocelyn. Over to you.
Thanks, Tamara. I just wanted to reinforce, I think this is a really great point that Fanny's making. It's so critical to recognize that pharmacies are community sources of community health provision, right? They are frontline community health workers. And I think that's really missing from so much of our global health dialogue. If we recognize that pharmacies are frontline community health providers, they are the first point of care in many cases, and in some cases, they're the only point of care. And just, building on this point that they're accessible sources of information, medicine, advice, rapid diagnostics, referral care, right? So they're not just dispensing medicine, they're doing a lot more, and they're doing a lot more for a very diverse range of clients, right? Pharmacies are accessible regardless of age, regardless of ethnicity. They are a key point of care for all genders, for key populations at risk of HIV, for adolescents who may not feel comfortable going to a health facility for contraceptives. So they really do need to be recognized by global health partners as a critical component of mixed health systems. Over.
I think that's a great point, and I think we kind of see it as a bit of a blind spot in some cases when we talk about even achieving the goals around, like, universal health coverage and other sustainable development, health related SDGs. We have to take the pharmacies into account because they play such a crucial role in providing health services. So, in broad terms, so we've talked a little bit about SwipeRx and Right e-Pharmacy, but I think, as Remy has kind of underscored in his overview, that these innovations go beyond these two organizations. These are just two examples, and there's a lot happening in the space. So, just a moment to kind of reflect a little bit on how these innovations are changing pharmacy practice and landscape of pharmacy service, and what the outcome or anticipated outcome is on access to quality services. What have been some of the key successes, and what do you see as some of the barriers? And I'll ask Jocelyn to start us off on that. Over.
Thanks, Tamara. Well, I'd like to just talk a little bit more about digital professional education for pharmacy professionals. I think this is really a game changer in our context. We know that pharmacies have been left out of national health program training and capacity building efforts because of the fragmented nature of the channel. It's extremely expensive, time-consuming, logistically challenging to scale pharmacy professional education offline. And in pandemic times, it's impossible, right? So this is a challenge that SwipeRx has been at the forefront of addressing in Southeast Asia. And through our app, for the first time, global health partners and pharmaceutical companies are able to train thousands of pharmacy professionals in a time and cost efficient manner, and also pandemic safely. So what we're really excited about is innovating with our key partners, who are pharmacy professional associations, to make accredited education modules accessible through a mobile device. So pharmacy professionals can complete the learning module at home, at their pharmacy, at a tea shop, whatever is convenient. And for the first time, they're able to update their technical knowledge about family planning, about COVID-19, about tuberculosis, about nutrition, about a whole range of critical public health issues. And through this innovation, we have become the largest source of free accredited digital education for pharmacy professionals. In the last year, in 2021 alone, despite the pandemic, we were able to generate close to 14,000 units of digital professional education across 15 public health modules that were deployed through SwipeRx in a number of countries in Southeast Asia. So we're really excited about this innovation, and very grateful for the support from the pharmacy associations that we work closely with. I think it's really exciting to see the way that the associations are embracing digital continuing professional development and training, and seeing that as a really important complement to some of the ongoing offline training.
Besides the pharmacy associations, Jocelyn, are there any other key stakeholders who are involved in terms of creating this market and reinforcing the need for professionalization of the practice? Over.
Absolutely. We definitely want to acknowledge critical global health partners, USAID the Bill and Melinda Gates Foundation, FIND, the World Health Organization, and a number of other global health partners who are working with us in this initiative. And we also should recognize the ministries of health. In many countries, the pharmacy associations encourage, and even in some cases, Cambodia is a great example of this. The Pharmacy Council of Cambodia will only accredit public health modules that will be deployed through SwiperX after the National Health Program relevant to a given module has reviewed and approved the content. So we work hand in hand with ministries of health, as well as the professional associations and a number of global health partners and stakeholders.
Brandy, any reflections on your end on how you see these innovations changing the landscape of pharmacy service?
Thanks very much. I think those have been great examples from the other panelists. I wanted to touch on something Frank mentioned, which is the fragmentation, right? And it has proven to be a major incentive for innovation. So when you look at countries like Nigeria with more than 3,000, 4,000, 5,000 pharmacies, access is being improved through the use of technology to aggregate these providers. They talked about, one of the speakers talked about, pharmacy waiting time or patient searching for products all around the place, inefficient way, right? Time and effort consuming. And you have innovators now that are aggregating thousands of pharmacies in their back end. So they present the user with a simple interface, usually on very simple devices. It can be on the web, it can be on app. And you have examples all over the place from Kenya. You have the Maidawa, where they just, identify what they want without having to go through all the shops and everywhere to see what's available. So you have product locators in Ghana, you have the MedRx, different types of apps. So these are improving the access to the medicines, the readiness to know their availability. But there's also another important dimension, which I think it's Jocelyn that mentioned that, I don't want to misattribute, but it's about pharmacies as being, prime sources of primary health care. So this has been missed by many, public sector, shall I say, distrust or over concentration on public facilities. But you have organizations like mPharma that are showing that the pharmacy can be the hub of primary care services. They're pairing with telemedicine applications, and you have products that they call things like multi-pharmacy, multi-doctor. What does that do? It allows the patient to go into the pharmacy and obtain care beyond just within the pharmacy. Connect with a doctor who is associated with this. And this is really changing, even the relevance of the pharmacies. And now governments, Nigeria, the public health, the NPHCDA, National Primary Health Care, Development Agency, just signed with the community pharmacies now, after many years of push to have them serve as access points for vaccinations, which would have been a game changer in COVID, but it came very late. But now it's happening. And the last one I would like to, draw attention to is the UHC aspect, the demand aspect. Without insurance, right, it's very difficult for people to keep paying out of pocket. So you have micro insurance that the innovators are putting into play. An organization like Wella Health, as it's called, right? It provides for the most common diseases of body, like malaria, very simple price, $1 micro insurance in partnership with the insurance companies. And patients can do the testing before treating in malaria. So they're helping to strengthen health systems by following guidelines, and they're making, as Christensen will describe it, markets creating innovation. These are people who would ordinarily not be captured in the health systems, but you have agent-led services being layered on technology. Copia in Kenya, for instance, focuses on rural areas, the underprivileged, right? And it uses the e-commerce model, but pairs that with agents who do the last mile delivery and help the user to create the order. So there's really a lot going on across the spectrum, and it's contributing to improving the relevance and role of pharmacies as sources of primary healthcare.
Remy. And I imagine some of this is also highlighted in the report that Salient is launching today. And I'm wondering how do folks, if they're interested, how do they access the report? Is there a link already available?
Tamara, when you open your praise and worship church or something, please send me an invite because you just read my mind. I created the link and you asked the question live there, and there it is. So I've posted the link and it's hot off the press. A lot of information across, improvements in access, availability, and affordability of quality medicines.
I'm reading your mind.
Very effective, Michelle.
Frank, over to you. We've heard a lot about these different trends that are emerging, and I'm wondering if you can talk to us a little bit about, what has been the regulatory response and who is responsible for this regulation? Because I imagine now it goes now a little bit beyond, just the Medicines Regulatory Authority when we think about, the e-commerce aspects of some of this. Apart from the regulatory authorities, what other organizations and institutions are responsible? And what do you see, what have you seen as some of the key barriers? Over to you, Frank.
Thank you, Tamara. So this is a bit of, and especially for African countries where we've actually been struggling a lot with regulating the brick and mortar pharmacies. So suddenly another layer is thrown on top of that. So it's we're in uncharted waters here, and it just feels like, and I know Remy has talked about this a bit earlier as well, about the fact that the regulatory instruments response has been a lot slower. And of course, it's okay for innovation to run a little bit before you catch up with it. I can't remember whether it was Reagan who said, if it moves, tax it. If it continues moving, regulate it. If it stops moving, subsidize it. So I think, just trying to figure out along that continuum where these e-pharmacy or online pharmacies are now. But the complexity around regulating online pharmacies, first of all, there's a quality regulation aspect, which is a challenge even for brick and mortar pharmacies. But then the other business aspects, there's, and some of these ICT aspects as well. Most of these in most countries fall under different institutional frameworks altogether. So you have, the communications or ICT authority. You have competition as well, concerns around monopolies and anything else that could happen because, one would think in theory it's quite easy to scale this to a sizable market without anybody checking. And then of course, now you have to keep to you also have to consider the quality aspect. So I think the major challenges have mostly revolved around the 4 Ps, as we call them, and and most of your pharmacists here, so you know what I mean. So as the product, the practice, the premises, and the person. And there's actually an additional P, I would argue, which is the process. So the regulators would really want to worry about, is this the right product? What's the quality of the product? The premises, where is it? Do we actually try to inspect, license, and regulate the warehouse where these products are kept? What's the chain of custody from the warehouse to the patients? Does that affect the quality of the product? What's the returns policy, which is common in e-commerce? How does that apply to medicines, and how labile they can be under different conditions? How do you treat all these things around that movement between the product and the premises and moving all the way to the person? Now talking about the practitioner, who's standing behind the computer, who's sitting behind the computer, how do you replicate that experience, that dispensing experience that pharmacists do through an online platform, and then how do you regulate that? So that's another major challenge as well. So you've seen innovations, for instance, in some countries, the pharmacy provider is actually the person who's involved in the deliveries. And so the dispensing is actually done in the proper way, you'd argue. And also by doing that, they also help some of the process aspects that are harder to regulate, like what do you do with the prescription? Because remember, there's a risk of somebody using a prescription multiple times. So using that model, perhaps it's an opportunity to actually pick the physical prescription, or at the very least have it stamped, as some country laws allow. So that's another challenge, Tamara. The laws are very different across different countries. Even what do you do with the prescription once the dispensing has been done? So that sounds like a small thing, but For the brick and mortar, it's a lot easier to deal with because you just need to stamp on the prescription and say dispensed. But if the patient is allowed to keep the prescription, what happens, for the online pharmacies? Because they could have made a copy of the prescription before, and they can use it in 10 multiple other places, even if you've stamped on the original prescription. So how then do you handle some of these aspects? So that then becomes a really big problem. And so I think countries are all struggling. Everybody's trying to figure out how do we get these, working right. I know higher income countries are putting a lot of emphasis on the dispensing experience and making sure the right medical advice, gets the right person, but also just making sure that some of those, consumer facing challenges, like, is it the right patient? Am I actually giving, the product to the right patient? So insisting on photo ID and all that, that's something that's happening in the UK, Australia, and other countries. I think in Africa, we are still, and it makes me sad to say this, but you're still worried about more upstream problems. So, just challenges around, is this even a genuine provider? Is this, is this a genuine product? Because, we have so many products around the markets whose quality you cannot infer. And, how do I even assure the quality to make sure that that person, whether it's the right or the wrong person, is actually getting the right product? So the regulatory responses have to be smart, and that's for sure, which basically means we can't rely on the traditional models of regulation, which entail a lot of, kind of police type of inspections, where you actually go to physical premises. So there needs to be a lot more smart regulation, possibly deploying a mix of instruments that include, bringing in ICT and communication experts, but also, kind of trying to keep the more traditional, regulatory system that are used in pharmacies as well. And then finally, Tamara, there's always a risk of over-regulation very early, because as this becomes a major concern, there's a risk that online pharmacies might start being held to a higher standard than brick and mortar pharmacies, which is not a bad thing in itself, except that overzealous approach could actually end up killing innovation, because sometimes, you need to find that balance between, well, you can't stop this fully because it's still a challenge even in online pharmacies. Can we create new laws that allow opportunities for us to change practice in this way, as opposed to trying to clamp down on online pharmacies? Because it almost seems as if there's a methodological barrier that regulators have to overcome to regulate the online pharmacies. And if they do that, I feel it would be a lot easier to completely clamp down on them, or even get rid of them fully, holding them to a much higher standard than the brick and mortar pharmacies. Yet, perhaps the solution should be trying to see whether it's possible to have different sets of rules for online pharmacies, simply because they bring certain advantages, and it's possible to have certain audit traits or certain reporting mechanisms that are harder to enforce in the brick and mortar pharmacy. So it's actually an opportunity for regulators, to figure out whether in fact this is something that we should be doing slightly differently, because it's easier for us to engage and get through to them once we go over this current barrier that we have, which is identifying, figuring out how to deal with the 4 Ps. Thank you.
Thank you, Frank. And I think you underscored quite well this tension, right? Because you need to ensure that there is protection of public health, safety. You need to ensure public health safety, but at the same time, you don't necessarily want to stymie regulation. And so I'm wondering, perhaps Remy, if you can speak to this. Are there any particular countries, I think you mentioned Ghana and one other country earlier, that started, you see, signs of regulatory response? What does that look like? And do you think they're heading in the right direction or not?
Thanks very much. I think a lot of health care practices driven by the maxim of first do no harm, right? And so a first do no harm philosophy tends to be very heavily safety oriented. And with that comes more restrictions than enablement. I think what needs to be happening is looking at opportunities for making sure regulations are innovation friendly and being open to feedback. And as many of the regulators themselves, I was hoping the gentleman from Kenya would be here. At Salient Advisory, we did organize a first of its kind meeting of the regulators of pharmacy practice in Kenya, Nigeria, Ghana, and Uganda. Unlike their medicines regulatory agency counterparts, which have a structure, right, for operating under the African Medicines Regulatory Harmonization that has now even been upgraded to a full agency, African Medicines Agency. Regulation of pharmacy practice, regulation of pharmaceutical care is far less, is far more, fragmented. So each country doesn't have the benefit of learning from the other. So the first thing to do, I think, is to create a regional regulatory forum for these practice regulators. And they can pick best examples outside the example of Rwanda, for instance. Whereas in the other countries, Ghana, Nigeria, Kenya, there's a requirement that only pharmacies that have a brick and mortar equivalent, just like Francis was saying, are authorized or are eligible to be registered or licensed as online pharmacies. Now, contrast that with what happens with technology. Technology brings new players into the ecosystem, the aggregators, who are deploying tech, but don't necessarily have to be pharmacists. They are not physically involved in the movement of the products. But as Frank said, there's a gap even in the understanding of the regulators. They don't know how to classify them. They've never dealt with them before. And so their laws didn't envisage any of this. But the good thing is that many of them are showing responsiveness to modify these laws to accommodate changes while still protecting patient safety. And the way Rwanda does it, for instance, is that you show evidence of a memorandum of understanding or an agreement signed with a physical pharmacy that will be responsible for the delivery. So the regulator has someone to hold accountable at the end of the day, which is that physical pharmacy that is involved in delivery. Fast forward to Ghana. Ghana, same situation with all the other African countries. Innovation is new and they want to regulate, but they use the opportunity to go beyond regulating online pharmacy and seize it as a moment for digital transformation of the pharmaceutical practice. So from digitizing the pharmacist records and all of those things to ensuring that the online pharmacies operate according to a common standard and are connected at the back end to ensure visibility and all of that. So this is the direction that I think countries need to go to show innovation friendliness while still maintaining that patient safety approach. I think that would be a good model to adopt.
Yeah, and I imagine there's always going to be a little bit of difficulty in getting that balance right, but it can be work in progress, and that's totally okay.
Absolutely.
Yeah. Fanny, I'm wondering from your experience now that Right e-Pharmacy is working, is it 5 or 6 countries? And I know you partner very heavily with the government, but can you talk a little bit about what the regulatory landscape looks like and how that's affecting and how you're reacting as Right e-Pharmacy to that landscape? Over.
Yeah, thanks. Yeah, it's 5 countries. So, obviously all different in regulation and approach, and I would say innovation readiness, if I can put it that way. But I think, without mentioning, per country, but I think, we've seen that, you really get countries that embrace any form of innovation. And that's quite rewarding because it filters actually through to the regulator as well. So and I think that's one of the positives. And I think one of the negative things is sometimes you get obviously countries where the regulators is obviously very strict and obviously wanting to protect the industry. But I also think it's important that we say to each other that sometimes some of our biggest challenges is actually the pharmacists, because pharmacists need to do what pharmacists should be doing. And sometimes they see any form of innovation as a threat or, a job loss or anything, but they forget about, the shortage of pharmacists, limited infrastructure, queues, overburdened facilities. So obviously sometimes, you get to a country where the pharmacist becomes your enemy, but you actually want to open, you want to actually help them to do what they should be doing. So it's also important to say that innovation readiness is really, really needed. And that changes from country to country, and I can tell you now, Some regulations took us 3.5 years. Some has taken us 3 months per country. So it's really depends on per country. But I think there's a lot of appetite for that willingness. And I think in a way, the recent pandemic has really increased the awareness towards differentiated models of care. And I think that was for us, our business, quite a blessing. And we've seen a rapid uptake of tech and support from ministries and patients and healthcare workers. And just for the simple reason is, then suddenly you can't even go to an overburdened facility. So where do you go? And then sometimes even the pharmacy is closed. So it really opened up the way of thinking and the acceptance of innovations, surely in sub-Sahara. So that was quite cool for us. But I think it's all how you approach it, and I think we make sure that we address all the concerns before we obviously pitch an innovation, and we make sure that we comply with what is needed. And obviously where there isn't a law, we make sure we get legal experts to assist us to draft that law to get approved. So it's really depending on country per country. But I think the big thing for me is if you've got a country that's ready, that's got an innovation readiness, it just cuts through the bureaucracy much quicker.
Okay, thank you, Fanny. So Jocelyn, you come at this from a slightly different angle. You focus more so on the practice, and Frank spoke earlier about the 4 and now the 5 Ps. And I'm wondering to what extent, like platforms like yours that focus heavily on, training of pharmacists and such, how it helping, because I think a big part of this is around the practice as well, right? And ensuring that pharmacists are doing as they're supposed to be doing now in terms of dispensing, but also counseling and such. And I imagine we know that there are gaps in the regulation, and I'm wondering to what extent, standards for practice, a culture around accountability and such. How does a platform like yours speak to that? And how do you see it encouraging or speaking to the issues around awareness of technology and those different issues that some of the panelists have raised as well? Over to you.
What a great set of questions, Tamara. Thank you for those. I think this is such a fascinating discussion. I think we, as a company that works in 6 markets in Southeast Asia, we're seeing some similar issues in our region in terms of the lack of harmonization, right? There's massive diversity from one market to another in terms of the regulatory context. I really like this phrase, readiness and receptivity for innovation. And I think, a lot of that stems from the professional associations, but also the stewardship role that host governments are playing, and the extent to which private sector, including private pharmacies, is embraced as a critical channel for mixed health system solutions. SwiperX, as the largest digital network of pharmacy professionals in Southeast Asia, has a massive role to play in terms of helping ministries of health, professional associations, and other stakeholders inform pharmacy professionals about the standards and the scope of pharmacy practice and promote compliance with those standards, right? In some cases, those standards and the scope may not be met because pharmacy professionals just aren't aware, right? In some cases, they may need some support. We may need to be investing in capacity building. In other cases, we may just need reminders. And I think on this issue of enforcing the regulations, I think it's important that we remember a carrot and stick approach is often going to be a lot more effective as opposed to a purely monitoring and enforcing consequences for non-compliance. So, the opportunities through a network that is connecting so many pharmacy professionals on a regular basis, right? They're opening the app to check the news feed because it's a source of pharmacy specific information. They're checking the Q&A forum on the app because they want to engage with key opinion leaders and be able to communicate with other pharmacy professionals and share a photo of a prescription they can't read and say, hey, has anybody ever seen a prescription like this? It turns out there are thousands of others who have. They're checking the drug directory when they have a question about contraindications or a substitute, et cetera. So leveraging that active user base to, for example, work with a pharmacy association to develop a digital campaign to raise awareness about pharmacy scope and standards, and design, let's be creative and let's work together to design an interactive campaign with rewards for pharmacy professionals who demonstrate that they're meeting those standards. The opportunities are endless, and I think that this is a really exciting space where technology can add an enormous value in the future.
And I think it would have been great to get the regulator's perspective on some of this. Unfortunately, that didn't work out, but there's always room to continue this discussion, right? So we spent a little time really talking about the tension and the need for balance, and in a sense that regulation is critical for ensuring health. But not inadvertently creating a barrier for innovation and market entry. I'm wondering if, as a kind of a bit of a summation around this discussion, if you can comment on this tension and the extent to which you think it is adequately recognized and is being managed, if at all. And we've already touched on some specific examples, but Remy, perhaps you and Frank could just kind of sum this up for us in terms of how you see, are there any critical pieces that need to be addressed? So if you had to think about, and it's hard to prioritize these things, right? But if there are 2 or 3 key things you want to highlight for the audience that, needs to change in terms of the regulatory landscape or action on the part of regulators, what would those 3 things be? We'll start with you, Frank.
Thank you, Tamara. That's an interesting question. So really looking ahead and recognizing that it's not a matter of if, it's a matter of when e-pharmacy replaces, at least to a meaningful extent, the traditional model. I think 3 things need to happen, and I think the sooner they happen, the better, and the safer for everyone. I think 1, there needs to be a proper design or redesign of a leadership framework or kind of that oversight framework for e-pharmacies or online trade of medicine that recognizes that this moves beyond the traditional boundaries of pharmacy practice. So, just agreeing with Fonny as well, this is not just pharmacy, it's e-commerce, it's business, it's online, it's ICT. There's a whole wild web out there that nobody in pharmacy was prepared for. And so the traditional regulatory systems, which are very heavy on pharmacists, and rightly so, are just not sufficient. So we need a better leadership framework that crowds in the different expertise and the different skills, to kind of guide how this process should work. So that's the first thing. The second thing is we need a common set of rules or standards, if you like. So we almost need to define what the crucial ingredients are for an acceptable model for e-pharmacies. So at the moment, that isn't the case. And that's fine because you're still at the innovation phase. So, there are different models. There's the full e-pharmacy model where click of a button, you do everything, you attach your prescription up to the time the doorbell rings and you pick your medicine. So that's one end of the spectrum. There's a whole range in between, including a mix of brick and mortar, including those where you buy online and you need to go to the pharmacy to pick the medicines once they're prepared for you, including some of those, to the other extreme where it's just you're using technology to connect different pharmacies. And so I pick a product and I'm sent to the nearest pharmacy that has the product and I'm told the price or the use. So there's a whole spectrum out there. And it looks like it's very hard to create a fair set of rules or standards when you are that first. But I think this is a time to start thinking, fleshing out what are the important components that need to go in an e-pharmacy model. So it starts from the model, it goes to the operations and how it works. Should there be a standard warehouse or store that is inspected and licensed? How should that happen? Who should be doing the dispensing? Is it the rider or is it somebody who's trained? All these things need to be agreed. How do you identify that it's the right person? What do you do, in cases of, suspicion of illicit, trade online and that kind of thing. So all these things need to be. So number 2 is the standards and just making sure that you're all on the same page. And last but not least is conformity assessment. And how do we ensure that there's good behavior in the market? How do we check? How do I, as a regulator, check that people are doing the right thing? And I think there's an opportunity here to share some of the burden with the providers, because that is something that we certainly in a lot of African countries are not managed to do in a meaningful way. So regulation has been a supply side issue. And if I'm not there, if I don't have enough resources to come to you, then you can do whatever you want. And since I've made it about me policing you, there's very little responsibility transferred to you. So I think there's an opportunity here. And that's partly because online trade in anything allows some kind of digital footprint, or allows a mechanism that can actually allow me to assess you, or it can actually allow you to report to me periodically. And that actually makes my work easier, because resources are always an issue when it comes to regulatory enforcement and checking. So there's an opportunity to improve the conformity assessment process, moving from the police style, the command and control style, to a more collaborative and cooperative model, where actually providers, responsible providers, make certain, do certain returns, and all I do is just do regular audits. This could be random, but other mechanisms just checking to make sure that things are actually happening the right way. Tamara, I think it's an opportunity for the regulator to show that they trust the pharmacists again, but at the same time, we just need to be careful to ensure that that trust is being put, to the right places or to the right people, because otherwise it's open for abuse. Thank you.
Thank you, Frank. Remy, what about you?
Yeah, thanks very much, Tamara and Frank. The regulators have a very unique opportunity to improve on the stakeholder engagement process. Typically, the most successful policies and regulations are those that are co-created by the stakeholders that are going to be affected by them. But that's not common for regulators. Regulators tend to have a top-down, almost police directive approach. And so the regulations are fixed without as much input from those who could provide, very helpful points. And then at the end, there's lack of adoption. And as Margaret Thatcher once said, where a majority of your people defy a certain policy or regulation, you don't have big enough jails to put anybody. It would just be a failure, right? So that process of stakeholder engagement needs to be encouraged to be from the get-go, start with the end in mind, involve the right people, including the innovators, and recognize that technology brings new players into the ecosystem, and be proactive in thinking, how do we encourage safety of lives, but also see the opportunities for improving livelihoods through the access and enhancements, as well as jobs that are created by these new technologies. That's one thing I'll talk about in the process. The second thing is the value of, as I've said, learning from others and not reinventing the wheel. So I think those who have taken an early step now have provided basis for what can become a model law, right? Reviewing what's good and should be retained about the current laws, similar to what you have with the, as I keep using the example of the African Medicines Regulatory Harmonization. So you have a model law now. So a country doesn't have to start from the scratch on how does it go about drug registration. A template is there that can be adapted. So creating this Pan-African approach that can provide, lessons learned and modify the laws so they are more innovation friendly while still maintaining safety, and take it on a Pan-African initiative is very important. And finally, I think the example of Ghana is the one I keep coming back to, that these innovations create an opportunity to look beyond regulation and look into using it as a platform for transforming the pharmaceutical care alongside the supply chain. A lot of technology has been directed at supply chain improvements. So you see things like traceability, GS1 standards, and all of that. But the pharmaceutical care component has been less exposed to the benefits of technology. So adopting a comprehensive digital transformation approach, using the Ghana model, and I hope it succeeds because it's early days yet, it's being piloted, can transform how care is provided, access is improved, while at the same time ensuring that patient safety is maintained.
Great, thank you. So I think you've both kind of really underscored the importance of having some kind of shift in the regulatory stance. So going beyond this brick and mortar model. And I like you pointing out here, Remy, the African Medicines Regulatory Harmonization Platform. They've done a lot of work in terms of trying to harmonize regulation of medicines and maybe having a similar model that they use in terms of regulating these new technologies, where you're not reinventing the wheel, but relying on each other in terms of, models of laws and regulations that you can adopt in your own space, but perhaps even potentially, as has been encouraged for medicines regulation around, reliance mechanisms, maybe something similar as well, because I imagine at some point, as these technologies mature, they're going to transcend, a specific market and probably be more regional based. So you will need that more of a regional approach as opposed to national approach. But this is really great. Thank you so much for highlighting some of the steps. So ultimately, this is about the webinar series that we're focusing on. Really, is what we're ultimately focusing on is equitable access. And so I'm wondering if each of you could just take a couple of minutes and reflecting from your own perspective on how you see these different innovations broadly in the case of Frank and Remy, but specifically for you, Jocelyn, with SwipeRx, and Fanny with Right e-Pharmacy, what you see as some of the key implications in shifting the needle for access to quality services for vulnerable groups in our populations. And maybe Fanny, you can kick us off. You already talked about Right e-Pharmacy and how 95% of your clientele is in the public health sector. So can you just reflect a little bit on what the equity impacts are?
Yeah, I think that obviously we could talk about the impact, but I think we also need to be critical when we talk about access, because it really depends on which forum you talk about access, and I think is, for me, in my arena of operations, being a last mile implementer and obviously program lead, access, and I think Francis touched on it, but access has got, for me, as a pharmacist, got two legs. The one is price, and then the availability. So it's, if sometimes in South Africa, for instance, we have the stock, but it's not at the patient. So so you've got access to drugs, but that's in the government sector, but the patient doesn't have access, and vice versa in another country. So I think what we've seen is, as soon as you start monitoring the patient, the commodity and the collection of the drug, then you can really start seeing the impact of what you're doing. So to give you an idea, we're running on our collect and go smart lockers, where we're monitoring just the pickup point. We're running at adherence rate of or pickup rate, because we still hope the patient drinks the medicine, but we can't take it further. But we're running at a 95% pickup rate. So and that's amazing. It's even higher than private sector in South Africa. So and that is across all the countries that we're operating. So I think to give you access, to improve access, you need to make the drugs available. And I think sometimes all the barriers that we touched on makes that access and availability the problem. And I think it's which we mustn't generalize, because it differs in each setting. But we need to say, if I'm a patient in a CBD and I'm a rural patient, what is my challenge? And I think that's where we as a business, we actually we don't innovate for innovation's sake. We listen to learn, and I think that's sometimes a big problem in the innovation space. People want to take high level innovations from all over the world and say this is the solution for you. And it's not the case. I think it's really to listen and learn on the patient and its journey. So I think if you start developing products around that, you just immediately improve access and availability for that patient. and in essence, healthcare outcomes. So yeah, that's our perception on it, so.
Thank you, Fanny. Justin, any thoughts from you in terms of the question around equitable access?
It's such a critical question, Tamara, and thanks for giving us a chance to emphasize. I think pharmacies are critical to equitable access to quality and comprehensive healthcare, not alone, but in the context of that broader mixed health system. They are geographically among the most accessible sources of healthcare. They are convenient based on their operating hours. There's a pharmacy every couple of steps in Southeast Asia. You're never far from a pharmacy. And for the community pharmacies, right, these are neighborhood providers. They remained open throughout, even the most restrictions through the pandemic. My neighborhood pharmacy became our source of vegetables in addition to medicine and health advice. So I think we really do need to think of them as community health providers and work, with host governments and other stakeholders, including the pharmacy associations, to better integrate them into the national health systems in which they operate. That's good for patient outcomes. And it's good for a range of public health priorities that we're all working together to address.
Thank you, Jocelyn. And we have, before the other panelists comment, we actually have a couple of questions from the audience, and I'll just give the panel a chance to respond. So what do the panelists see as the role of self-regulation and health professional associations in e-patient-centered pharmacy services? And Jocelyn, maybe you can respond to this one for us, given the focus of Swiper RX. Over to you, Jocelyn.
I love this question. I think I'm so glad that it was raised. One of the things that I think this links a couple of different topics we've been discussing today together in the context of the global self-care movement, and considering the great diversity in terms of standards and regulatory contexts in which pharmacies, offline and online, are operating. There's a real need and opportunity, I think, to harmonize and again, look at those opportunities for pharmacies to improve access to self-care. A great example of this is, according to the World Health Organization, trained pharmacists are able to safely provide injections, but how many LMIC markets around the world have local regulatory guidelines that allow pharmacy professionals to offer cyanopress, for example? So I think that's just one example, but there are so many linked to that. And I really encourage all of us to think creatively about how we can expand the opportunities for pharmacies to, provide, to help their clients make informed and comprehensive choices. And that includes equipping them where appropriate with self-care.
Thank you, Jocelyn. Another question from Michael. He says, greetings from Uganda. There currently are problems of regulation of e-platforms. How can governments be encouraged to improve e-pharmacy practices and identify measures for regulating this platform? And we've kind of touched on this previously, especially with responses from Frank and Remy. But perhaps, Remy, you can just quickly recap for Michael.
Yeah, thanks, Michael. Uganda is one of the countries that Salient Advisory has focused on in terms of evaluating the state of regulations for e-pharmacies. And they actually also are at an advanced stage of publishing their regulations. I think they just had a small component of the guidelines for the transportation, because they've gone an extra mile to also specify the standards that need to be adopted for delivery and last mile fulfillment of online pharmacy orders. So they are already in the process of enacting the regulation, and I think it's just a matter of a short while before that becomes published. The larger encouragement is that the International Pharmaceutical Federation has taken the principle, and that's the global association of all national pharmacy associations, has taken the online pharmacy practice segment as a critical part of digital transformation. And it has the provisions to support country governments in identifying best practice and tools that can enable them establish, innovation-friendly regulations for online pharmacy. So I hope that answers Michael's question.
Thank you, Remy. Jocelyn?
Thanks, Tamara. I was just reviewing the wonderful comments and resources that have been added into the chat. And I just wanted to thank everyone for your active participation. Great comments and questions. And circle back to one question that I think I haven't fully answered, which is, what's the potential to leverage technology to help pharmacists self-regulate? And one part of that could be, for example, leveraging technology not only to provide continuing professional development, professional education modules, but also, just as with offline training, we follow up. We don't stop with the initial training or even refresher, but we follow up then with a self-assessment, as well as in some cases, an external quality assessment. I think, we're just really at the tip of the iceberg when it comes to exploring digital approaches to pharmacy professional education. But as this space and as these innovations continue to develop, I hope that will include developing this into a broader and more comprehensive capacity building and pharmacist behavior change initiative. And there's a lot of potential there as well. Thanks.
Great. Remy?
Yeah, just to build on what Jocelyn is saying, with the digital platforms improving access to continuing professional development, I think one thing that can help to fast track the adoption of pharmacies as sources of these greater public health services is evidence building. So a lot of the things that are being done need to be captured in a rigorous and systematic way that can lend credence to their value. So you have situations, for instance, where, as Jocelyn described, for China Press as an example, the DMPASC, there's concern because it sounds like, oh, injectable. Pharmacists, are they trained to do injections? But if something is supposed to be for self-care, meaning even the patient is supposed to be able to administer it, you'll imagine that a trained healthcare professional will be able to do that. But you don't just say, oh, I'm healthcare trained, therefore I should be able to do it. You show the evidence, you follow the preceptors, you do examples, and then you document this, and it becomes a way to change policy to include pharmacies as better, more available, accessible sources of primary care. I just wanted to add to that.
Thank you, Remy. And Fani, over to you.
I think I just want to maybe echo what Remy and Jocelyn are saying. I think what's interesting is, as soon as you start breaking the barrier and people, especially pharmacists, see the impact of the outcomes, and they also see the value of innovation within the industry, they actually become your biggest advocate for change. And what we've seen is now that there's a big push from hospital pharmacists in South Africa, in the public sector, to say, why is only 3 pharmacies automated in South Africa? Same amount of staff, dispensing system, but with a 70% higher output. So where automation was always like a bad word in pharmacy, it just went through a different level. And we're literally struggling to get government now to fund some of our innovations. And like in Lesotho, our biggest advocates are actually the private pharmacies, which we incorporated into the programs that we're assisting with the government. And it's interesting, we're now measuring, what is the value of a patient that should have been queuing at a state facility by now, let's say, as a chronic stable patient. What is the value that they're getting when they're picking it up at a normal pharmacy? the pharmacists are getting a pickup fee, which is one thing. But what we've been able to do with certain retailers in South Africa is, they all got, especially the bigger pharmacy groups, they've got value, membership cards, etc. And they've said that, they're getting paid, let's say, for instance, 10 Rand, but at the end of the day, they're working out that each of those patients are actually spending 170 Rand while they're there, because, they're aligning their shopping, it's more than just picking up your chronic medicine. You've got OTC, you've got baby milk, female care. So it's the biggest advocate must actually come from the pharmacist, because if the pharmacist buys into it and sees the benefit and actually gets the reward of that as well, it just puts so much pressure on the regulator that I can tell you we've been in very interesting debates and topics at conferences, and I was actually asked a lot of questions, which was actually answered by public health pharmacists. So I do think, if you take the profession, that in essence is driving, I would say, the heart of primary care, and it's how we as pharmacists collaborate to make sure that we advocate it correctly, we embrace it, and we put pressure on the regulators, not see it as a threat. And it's interesting. I was at a conference last week, and it was about automation, but it wasn't. It was a different industry, and there's a lot of issues now. Obviously in South Africa, e-commerce are booming. It's robotic picking, it's robotic this, robotic that. So and this was a conference about moving goods around in the world. It's the supply chain conference that was in Cape Town, and the one guy showed a video of the Grand Prix racing in 1968, and in the pits was four guys in the pits, and it took 1 minute, I think it was almost 2 minutes, to change the wheel, to fill it up, etc. So, and then they took a Ferrari in the current state in the Grand Prix. It was like literally 3-point-something seconds. It was filled, 4 tires changed, but there were 16 people in the pit. So it shows you that we must also sometimes just open up our mind and realize there's other benefits. And it's not about job losses. It's about making the industry a bit more agile, and because we keep on asking ourselves, what can we do? We must actually see what else can we do. So and I think that's the one thing. So make the pharmacist your friend, and the regulator will follow. So thanks, that's all.
So mind shift both on the part of the pharmacist, and also hopefully that will also prompt the regulator to shift as well, and hopefully act. So we're close to time, and I wanted to give Remy and Frank a chance to perhaps reflect on our discussion and provide just a summation and global outlook. And maybe we can start with you, Remy.
Okay, thanks very much. I think it's been a great conversation. Thanks to the audience also for their questions. My critical recommendation is always using a systems approach to improving things. When we focus too exclusively on the one part, in this instance, like online pharmacy, we miss the opportunity of transforming the entire care system. So as Frank and others mentioned, for you to have successful online pharmacies, you need to digitize the people, the places, the products, and the processes. And so you're talking about e-prescription systems that will work against the use of one paper prescription being uploaded into 10 pharmacies, right? So e-prescription systems that cut out that paper, you need to have the payment systems that are embedded and make it easy to offer even some of the donor funds through subventions, subsidies, and all of those kind of things. So that health systems approach to look at, adjacent services, e-prescription, the database of authorized prescribers and pharmacies and all of those kind of things, they're very important. The second thing is the healthcare financing. Where there's UHC, you see a lot of the government services making only public pharmacies eligible. The money should follow the patient. So if the patient chooses to access his care, which is 50 to 60 or more % in parts from pharmacies, then they should become eligible as sources of beneficiaries of healthcare insurance systems, because largely until out of pocket is reduced, real access, as was mentioned, will be missed. It's not just about physical access, product availability, it's also the financial access that is required. And the final thing is to look at other sectors, just like the last speaker said, right? Financial services sector is a great example to look at. Careful and strategic over 20-year period reform is what has led to Nigeria, Kenya, and other African countries leading in fintech services and producing unicorns. So that systematic approach of a reform mind for digital transformation of pharmaceutical care and supply chain will be very beneficial.
Thank you, Remy. Over to you, Frank. Any final summation or global outlook that you'd like to share with us?
I think a lot of wisdom has come from the panel, very well summed up by Remy Oga. But just to emphasize that in a very broad way, that I see this this conversation, and I see e-pharmacies broadly as a great opportunity to re-engineer primary healthcare services, riding on the technology and innovation wave. I almost see smart use of online pharmacies as platform ecosystems that allow delivery of comprehensive primary healthcare services and basic curative services. So Tamara, imagine a situation where your entry into this system, almost through a very quick screening mechanism, allows you 1 or 2 or 3 pathways. One of them is direct link to our consultation services at $1 or something really, really affordable as an option, because it looks like you wanted to buy a prescription medicine without prescription. Another option is to just send you to a pharmacist because it looks like you need medication advice. And I saw Dr. Kusu has asked a question here about how can we leverage this to actually optimize the pharmacist's role in terms of providing counseling and medication advice. That could be a different gateway, that could be a different channel where you pick up that this is a chronic care patient who's obviously on this treatment and they actually could benefit from pharmacotherapy for pharmaceutical advice from a pharmacist. So it's not just trade, it's not just exchange anymore. It's about, you're in this room and somebody's asking, do you have any questions about your medicines? Do you have urinary incontinence? Do you have these and these? Yeah, that comes because of the medicines. That becomes a big benefit. And then the third one, of course, is just the over-the-counter sale of medicines. So that becomes a very interesting entry point into delivering other interventions, including family planning and any other services that you might actually want to do. And underlying all that is an opportunity for machine learning and using smart methodologies to actually look at the patterns within the population, pick out key data that then goes back to inform information that is fed back through the various systems, whether it's frequently asked questions or whether it's figuring out which areas patients need the most information on and everything else. So in summary, I think this is a great opportunity to create platform ecosystems that allow services to be provided more widely. That's why it's absolutely crucial that we respect the innovation and we give it space to grow, but it's very important that we study what's happening in e-pharmacy and really try to understand how we can improve that. And Catherine, who is on the call, I think, I don't know whether she stepped out. Catherine and I just got a grant recently, and we just started doing a bit of work in Kenya and India, trying to characterize the markets for e-pharmacy, but also propose regulatory approaches that would effectively deal with some of these challenges. Thank you, Tamara.
Thank you, Frank. And with that, I say congratulations to you, Frank and Catherine, and looking forward to the products from that endeavor. I think we've had a very rich and engaging discussion. And I think, several points here around, the need for innovation friendliness and an acceptance, viewing this as an opportunity for rethinking how we envision primary care, as you've highlighted, Frank, but also highlighting some specific steps that regulators can start to take in terms of thinking through, how they try to get at this balance and achieve some innovation friendliness, while also, again, of course, giving space for innovation to grow, and also trying to protect public health. So thank you, everyone. And before we sign off, for those of you still on the call, please note that there are several resources that have been posted in the chat, both on SwiperX, Right e-Pharmacy, the report that came out from Salient Advisory that's being launched today, and also a very interesting paper around, technology and regulation that was put together by Frank and his colleagues. So thank you very much for your attendance, everyone, and for your interesting questions. And special thanks to our panelists. I think you've really shared some gems with us today, and we really appreciate it. Take good care, everyone, and be well.
Thank you very much, Tamara.
Thank you very much. I'll email you, Remy.
All right. Thanks, Francis. Thank you, Tamara, and everyone. Bye.
I'll connect with others as well. Thank you.
All right. Cheers.